So, hello everyone, and thank you for joining us for this Friday afternoon Return to Work Personal Skills and Wellbeing webinar brought to you by Maudsley Learning. So this is the outline of the session. We'll probably go for an hour, just some housekeeping and introductions first, and then we'll just give you a bit of context for our past work with returners. I'm going to introduce some personal skills and well-being principles over the first half an hour. Then we'll have a panel discussion with two of my colleagues who've been sort of heavily involved in return to work programs with us in the past. And then we'll have an opportunity for a Q&A. So just a reminder, this is a webinar, so your microphones and videos are off, but we will have a chance for a bit of a discussion toward the end. So my name is Owen. I'm a fellow in medical education here at Maudsley Simulation. I'm also a forensic SPR, Northeast London, and I am out of program at the moment and soon to be a return to worker. So although I'm not an expert in this area, I'm keenly interested in it because it affects me so much. And I'll be joined by Sandra, who's senior nurse and clinical educator here with Maudsley Simulation, and Chris Atto, who's head of research and development with us also. So today, really just to understand key concepts in relation to personal skills and well-being for doctors returning to work, and about understanding the main needs of returners in terms of personal skills and well-being, and we'll have a little bit of signposting as well to some resources. So Kieran, we might start with the first poll, if that's okay, just to see who we have with us today. We'll have 2 or 3 of these. So if you're able to run that, that'd be brilliant. Excellent. London's looking like it might take a lead outside London, 50-50. Okay. Perfect. Oh, okay. Outside London has topped it. Brilliant. And Kieran, can we have the next poll, please? So all based in England. So this is just how long you've been out of practice. Okay, so kind of between 3 months less and 3 years. Okay. Brilliant. And now for the final poll, Kieran, what specialty did you mainly work in? Let's see who we have with us. Medicine, a few surgeons, some other. Okay. Brilliant. Okay, Kieran. So we'll finish the polls. So thanks very much, guys, for completing that. It's good to know who we have with us. We've been working with returners, doctors returning to work for a few years as part of a health education and funded program. We've delivered boot camps, specialized courses, and been involved in personal skills and wellbeing sessions. We've trained a variety of professionals, and what's really developed from our work is a core ethos around supporting returners to build supportive networks, to develop reflective space for them to explore some of the impacts maybe being out of taking a step out of their career and transitioning back has had on them, and helping them build confidence to negotiate the transitions as well. Why is return to work important? In the UK, 10% of trainee doctors are out of practice at any given time. Loads of reasons why someone might step out of practice. It might be planned, say moving country, moving house, maybe a pregnancy. It could be unplanned in response to, say, ill health or change in circumstances, childcare, you name it really. So there's a diverse array of experiences and challenges or experiences out there. But there's some challenges, I think, that are specific to doctors, and some of these may relate to self-stigma, maybe experiences in life that might challenge or change our professional identity. And for some people, it may be very linear, like myself, I suppose. I stepped out for a year and plan to come back. But for others, it might be, depending on circumstances, a more meandering course. And there is evidence that occupational well-being does link to higher levels of patient care. So this is really important. Being out of practice can be isolating. It can be stressful going and negotiating, leaving and coming back. And even though there's a diverse array of experiences, some common themes emerge. So this painting is very opposite to our times. It was Semmelweis is an obstetrician, I think, in the 1800s, and he essentially invented hand washing, really, in brief. But what struck me about this was the people, and it reminds me just about when you're working in medicine, it's all about professional relationships, personalities, communication, and nothing really has changed there in 200 years. I think you'd probably just change the clothing, maybe a bit less formal. So these are a few of the topics that I'm going to introduce. There's quite a few, and if it does feel like I'm moving through them a bit briskly, we do have a workshop that we're going to have in the new year, which I'll mention later, and we'll be going through these in a bit more depth during that session. So well-being is more than just functioning. It's a sense of flourishing too. And well-being is incorporated into the WHO's definition of health. And it refers to when an individual realizes their own abilities, can cope with normal stresses of life, works productively, and is able to make a contribution to community. So, and well-being exists at an individual level across a few different domains. So your psychological well-being, how you handle stressors, being able to stay positive, having a sense of purpose, physical well-being, social well-being, your feeling of belonging, having positive attitudes about people around you, and the potential to maybe improve society. But then the subjective well-being as well is your own self appraisal of how you feel. And even beyond the individual, at a team and an organizational level, there can be well-being and equally dysfunction at those levels. This is one of my favorite things on the internet, Google Trends. So you can search and generate a graph or how frequently people are searching for things over time. So this is well-being searched worldwide over 5 years. So a steady increase and no surprises for the spike. Who can guess what the spike in the right was? That coincides almost exactly with March 2020. So there you go. So in thinking about well-being, I suppose we're very used to thinking about physical health and mental health in terms of biopsychosocial approach, and the same things apply. I suppose what's important to remember is these factors can overlap and interact as well. And it's often never just one thing that impacts on our well-being. It's often a multifactorial thing. And I think having an awareness of different frameworks can be really helpful if you want to tease apart maybe why things don't feel quite right, or why maybe you might be struggling a little bit more than you'd like. There are other things as well that, of course, linked to well-being, like stress, emotions in the workplace, team working, experience of bullying, and conflict, your own resilience, the leadership that's at hand, also the support, and that's where we fit in, really. The return to work process and programs like HEE have on offer, is that's an opportunity for you to really take control in that context and support your well-being as much as possible with people who are experienced navigating these things. And the list goes on there of other kind of organizational considerations, I suppose, that can have a bearing on your well-being. In med school, unfortunately, I think the stress, the years, and the habits, can impact on our health, and maybe some of these habits can be hard to shake, about maybe unhealthy eating, exercise, alcohol misuse. And then as doctors go into their working environments, there's a few common areas of concern that consistently emerge from returners. Worries about the workload. Will there be too much? Will I not be able to get it done? What if I'm not able to cope with the emotions? What if I don't have control and I get sent somewhere, and how will I cope with travel and being away from my family? Going back into hierarchical systems, and specialties differ, and some can be quite hierarchical, and I think there can be more feelings of maybe bullying, and that can coincide with the level of task delegation there is, say. The culture as well. Culture can change over years, and culture can change within an organization and more broadly within a profession. For example, there can be more litigation maybe around certain procedures that might be a worry. All these stresses and strains can lead to negative feelings in ourselves, and our own personal standards, our own values, our own personality traits, and indeed the career choice that we've chosen can have a bearing on how we manage all these things. So burnout, I'm sure you've heard of these terms. I'll just introduce them. So the WHO have recently updated the definition to syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed, with a few key features. So I'm sure anyone that's been experienced elements of burnout or seen it in colleagues, this would be very familiar. Feelings of energy depletion or exhaustion, a feeling of distance from your own job, or negative feelings about your career, and a feeling that you're not as productive. So if left untreated, burnout can spiral a bit out of control. It can lead us to become depressed, anxious. It can lead us to feel very out of control in managing difficult emotions and managing our relationships, both at home and in the workplace. Resilience, on the other hand, is the ability to maintain well-being during periods of difficulty. And I suspect among medics there might be a tendency to medicalize, as we're prone to do, rather than thinking, as we do with other conditions, about the biopsychosocial big picture, the multifactorial nature of things. I think whether you take or leave these terms, I think it's useful to be aware of them, because when you have a framework, you're able to, reflect on your own needs, and any changes that might have happened in how you feel, and how you can care for yourself if you start to feel things slip, and how you can foster a sense of resilience also. Burnout is common, so depending on where you look, it's been reported to have been experienced, say, over careers between one third to 2/3 different healthcare professionals. It can vary in how it manifests, from just simple fatigue all the way down to, a more serious illness maybe developing in the context of chronic stress and immunosuppression. Other people, you might not notice. Other people might notice you're less productive, you're not as positive, making mistakes perhaps, and maybe patients, there may be complaints, maybe patients are the more indirect markers of maybe burnout. Patients are not as satisfied. And resilience isn't just about being able to bounce back from what's ever thrown at you. It's about maintaining a sense of well-being during these difficult times, and space for reflection and being able to set boundaries are really, really important in being able to build resilience. Any life change can be a stressor, and any stressor can impact on well-being. I think it's useful to be able to categorize the different stresses you have, and I think it's helpful sometimes. There's a scale that's been developed which sort of charts, I'll have it on the next slide, the various things you may encounter in your life. And I think it's helpful to have something like that, because you can sometimes lose perspective, or it can all become a bit muddled, and it can be helpful to be able to communicate what you've experienced and what you are experiencing, and to acknowledge that these can have a cumulative effect. So you see things here that you might overlook, like mortgage stress, or changes in residence, or taking on a loan. Are there more major things, like having a major bereavement, or your marriage deteriorating? It can be really, really stressful, and the nature of life is often these things kind of come together. Self-care, so looking after your own well-being. You may be familiar from medical school, I'm sure, Maslow's hierarchy of needs. So this ties into theory of human motivation. So at the bottom, we have our basic physiological needs. And then as you go up in the pyramid to more higher order things around safety, love and belonging, esteem, feelings of accomplishment and self-actualization. And when we think about developing programs for returners, when you look over on the right of the slide, we try to tap into these basic needs, and I'll go through some of these in turn. So psychoeducation around basic needs. These are the real fundamentals: diet, exercise, sleep, alcohol, the ways to well-being. And often these things, we can slip, we can develop bad habits, we can lose perspective maybe that our habits have slipped. We may be teetering towards burnout and not be really aware that we're running on empty, and we're not sleeping, or we haven't exercised, or our routine has gone out the window. So it can be really helpful to be able to check in with these basic things. The NHS 5 steps to well-being are recommendations and reminders really about how you can build plans to maintain your well-being. So the importance of connection, meeting with people, catching up with old friends, taking time to talk to people really, and to click, being active, getting the heart rate up, getting out in the fresh air, learning new skills, a new hobby maybe, giving to others, not just money or donations, but of your time as well, and taking notice, taking time to pause and reflect. All of these elements can really help boost your well-being. And I think the pandemic for many has brought these into sharper focus. For many of us, we sought out new ways, or did more of this list of ways to well-being, like exercising outdoors. We're connecting with old friends maybe that we'd lost touch with, and I think really in the restrictions we really highlighted how much we need these basic things that, when I suppose in normal times we might overlook. That's a fitness class on the right. I can't remember where, but it's a rooftop fitness class, and that is one of the Nightingale hospitals being built. So positive psychology. So this is a newer field of psychology that came in the late 90s, and it refers to study of positive subjective experiences, traits, and institutions to improve quality of life. And it has a very practical, humanistic focus. Its main aims are around shifting perspectives and how we frame situations. And we've used principles from positive psychology in our work with returners to support them to build, I suppose, understanding, to develop reflection, and foster a sense of resilience as well, and confidence. So happiness is more than or longer term satisfaction from meaningful activity and self-expression than material purchases and instant gratifications. I think for most people that agree with that, but sometimes we do have to be reminded, and everyone has different set points as to how we achieve it. I think for most people, about 7 or 8 out of 10 satisfaction is pretty good. And I think having unrealistic expectations can be a route to unhappiness in and of itself. So I think we try to really build appreciation around where we are in our lives, and the things we've achieved, without putting too much pressure on ourselves. Mindfulness, here's another one of my graphs. So this is from 2004. So interest in mindfulness has steadily increased, and it's almost inescapable, really. But often, sometimes we mightn't even have thought about, what is actually mindfulness. So mindfulness is observation without evaluation or attempting to change, and it really ties into that last way to well-being from the NHS, about taking notice. So it's about being aware of the present moment, and this can really support us to be our sense of enjoyment and gratitude in life. And if we do it regularly enough, we can help reduce stress and improve our mood even, and it might have wider benefits on learning and memory. And there's lots of exercises that are sort of linked to this that you can do: breathing exercises, body scans, meditation. There's different types, like the mindfulness of breathing, or loving kindness meditation, or even taking a mindful walk. And I would highly recommend this app, the Headspace app, which is free for NHS staff. I was skeptical initially about how another app on my phone could help me to be more mindful, but I'm definitely a convert, and I'd really encourage you to give it a go. And it can have these helpful reminders that gets you to schedule into your day, and it has like gamified features that kind of make it a bit more fun, and you can buddy up with someone as well that uses the app also. So I'd really recommend you give it a go. Coaching, we use principles from coaching in our work with returners. And coaching is, for anyone that's not familiar, it's a medium where through facilitation with a coach, people are supported to aim towards specific goals and objectives, and coaches might use different frameworks or tools to do this, to say help people establish perspective, to gain a deeper understanding, to reflect on maybe difficult periods, to help them formulate goals, maybe through visualization, or if they feel very directionless, perhaps to really refine what their actual values are, so that they can help find direction, focus, and meaning in their, say, career choices in this context. In terms of relationships, connection and sharing are really important, as is communication. This obviously holds for our personal and professional lives alike, so it's not something we neglect either. We're built to connect. We have evolved to do so. We're wired up for it, and I think we get rewarded for connection, at home and in the workplace. And And you know, if ever you need evidence of that, we find rejection so painful. And it's no surprise that connection is one of the key areas of well-being. So we need to share affection as well. We need to build healthy relationships in work, and there's different ways that people express appreciation. So through quality time, verbally, acts of service, giving, maybe physical touch even, and that's something we acknowledge is important. And if you've been away from the workplace for a while, it can be sometimes you may be unsure of your footing a little bit as to how to communicate affection with people, and that's something we're keen to look more at and explore with returners. Wires get crossed sometimes in communication, and certainly in the workplace, there's lots of challenging conversations and interactions we might find ourselves in. Sometimes it might be the setting that's not really suitable, or we might be hungry or angry or tired or something like that. There might be a conflict that's set up, it might be a very looped conversation that's happening, and we're not quite sure how to get out of it. Or we might have troubles maybe with our confidence in being assertive. Perhaps maybe we might be not used to using language, or maybe we might say the wrong thing, maybe like speaking in absolute terms, and that might get us into a bit of a sticky situation. Equally, we might need to get used to attentive listening as well, and using silence and space in communicating in the workplace. Connecting with your emotions is really important as well, and that doing that in a work context is something we might be a bit rusty at, and you know that might be something that you might want to explore more, or depending, I suppose, on the specialty that you're in as well. Your needs might vary, and we're used to supporting returners with that. So at this point, what I'm going to do is invite my two panelists, my colleagues, Sandra and Chris, on board. And what we're going to do is just go through some of their observations, experiences, and reflections on our work with returners. So without further ado, so Sandra, do you mind just introducing yourself and maybe your professional background and your work with Maudsley Learning?
Okay, yeah, so hello everybody. My name is Sandra Parish. I'm a simulation nurse tutor at Maudsley Learning, Maudsley Simulation. I've been working with a team for about 5 years. Previously, I worked as a dementia care matron. I led on a lot of courses, developed a lot of courses. I particularly around working with new and emerging roles within the NHS. So with nursing associates and also care navigators and other sort of roles within admin and clerical. So yes, that's my area of expertise. I also, in a previous life, used to be a return to work facilitator within the nursing directory of the Maudsley. So that's really where my sort of special interest in return to work came from. So I really did feel like I had some sort of transferable skills from a previous job to sort of bring into this particular course.
Definitely, that's great. And so, in terms of, so you'd seen return to work projects before with nurses, and
Yeah.
what can you tell us a bit more about your work with this return to workers for doctors?
Yeah, I guess there's a lot of similarities really between like the nurses that I work with, but also with the doctors as well. I think they've all, left work for lots of, like, a variety of reasons, really, whether that's, for childcare or, particularly with the group that I was working with previously, there was, bereavement,
Yeah.
there was people that had taken a year out, and which sort of then became 2 or 3, and then they sort of really lost the confidence to be able to come back. So there was sort of everybody's reason for coming back is really, really unique. And but saying that, there's a lot of similarities about making that sort of step to come back and to sort of like put your foot in the water to see is this something I really want to come back to. I mean, I felt there was a lot of, I gave my nurses a lot of support when they went back to practice, and I certainly saw a lot of the doctors, mentors, really going the extra mile with their sort of with the people that were returning. And I guess at the moment, I suppose it's worth thinking that actually, the NHS needs doctors and nurses to come back into practice, and that it's very much it's the sort of the what was I trying to say, the sort of the there is certainly a need, and I think that the things that I hear from our trust is that we really need to encourage people back, and so it's very, very so there is that sort of a buyer's market, so to speak, as far as sort of doctors and
Definitely.
nurses come, that actually this is a resource that we can't really afford to lose, and we really need to bring them back.
Yeah, definitely. And I suppose from your nursing background, was there anything you noted about working with doctors? Anything about the culture maybe, or the different specialties?
Yeah, I mean, I think that I guess the sort of the thread was really that people had this, they'd spent years and years refining their skills, and I think with doctors you do 7 years, with nurses,
Mm.
we do 3, if not more, if we specialize. So there's this sort of feeling that you've done all this training, and it felt really, I think, with the people that I saw, it felt really, really important to get that back again,
Yeah.
and to really, sort of, it's part of who you are as a person, and when that goes, it's really hard to get back. It feels like a part of you sort of missing in a way.
Yeah, so that kind of loss of an element of your identity, maybe
Yeah,
your professional
yeah,
identity. Yeah, I think
definitely,
that's a
definitely.
theme that's come up. We might hear more about that with Chris actually. And I'm just wondering. I know you touched on this at the start, but we probably can't use specific examples. But
Mm.
I wonder if you'd mind giving maybe some examples of the types of difficult situations returners have gone through.
Yeah, I mean, as far as sort of the challenges they face coming back, or the sort of situations that they've come through. I mean, I think the thing that struck me with the people that were coming back, their situations were really unique, and we had someone who had bereavement, which is like
Mm.
100 points on your scale, so
Yeah.
that their partner died, and the challenges that she felt coming back. It was it was so important for her to come back to work, but there was so much
Mm.
going on in her life. But I mean, she came to the course, she lasted the whole time that she was there, and she did, what was great is she really developed this amazing network of people during her time on the course. So I mean, her story really sort of struck with me, because she was really dealing with so much, to really sort of to get back. So many challenges to
Mm.
getting back, but she managed to find a placement. She had a really good sort of mentor or supporter. Can't remember what you call it in medicine, but yeah. So I mean, it was,
Mm.
yeah. I mean, people that have had children with disabilities, where they'd had to spend a lot of time with them, people that are just taking a break, really, just because
Mm.
they you know they just wanted to spend time with their kids. So, and sometimes mental stress and mental health was an
Mm.
issue for some of the people that we had on the course. So again, there's a lot of preparation um that they had mentally prepared to come back as well, which I think was a real challenge. So yeah,
Yeah.
so those are the sorts of things that people were returning, to the workplace, having those sort of challenges, really.
Yeah, and I was wondering just if you've taken a step back from work, you can feel very disconnected from it. You can feel like that part of you is maybe fading away, and that everything's happening elsewhere. Um,
Yeah, but
and
what was lovely is when the participants came on the course, they really engaged with that aspect of themselves really quickly,
mm,
because actually what they found is, when we were doing practical skills, that they really they were like, I can still do this. This is okay, actually. This is fine. And then, but I think the thing that they really got from the course was actually how many other people were in a similar situation to them.
yeah,
That were maybe struggling, or that really wanted to take the plunge, but weren't really sure whether this was the right time or not. So yeah, so it's sort of there was lots of various reasons, but there was lots of common threads, and there was lots of camaraderie with the people on the course,
mm.
that really, really boosting their confidence.
I think probably connecting with people in the same situation, it can help you maybe regain perspective as well. That it's not just this unique experience, although your individual challenges are unique to you, but the pathway, is a well-trodden path, definitely.
It is, and I think when you come off your rotas and things like that, you lose. You might still stay in contact with a few people, but that sort of broader doctors community, you might not, have those sort of links anymore.
Yeah, and it can be hard sometimes that maybe the people you've trained with have moved on to different corners of the country, and sometimes like the return to work program or re-engaging with conference events can be good places to start, definitely. Is there anything that surprised you from the work you've done with the returners, the sessions?
No, I suppose it's a little bit more about what I said previously, that sort of resilience of some of the people that came on the course, and their determination really to come back, and how much life had thrown at a lot of people. And I guess it wasn't surprised so much as thinking that actually these people have got so much to offer. They've got these amazing life experiences and insights. And I sort of wanted everybody to come and be a psychiatrist, but I don't know how realistic that was.
Well, we might convince one of the audience today.
They have a lot to offer the workplace, because they've had, they've done their medicine or their doctor's training, but actually they've got all these amazing life events, and actually the things that they've learned from those life events are really, really important for their work.
Yeah, especially if they've been a patient themselves or had a loved one who's had a lot of health needs.
Definitely.
That can be so valuable, and
so
much to add to the profession. Definitely.
Definitely.
Any advice to any potential returners listening in, Sandra?
So I would say, even if you're thinking about it a little bit, I would say come and see, because you might decide that this isn't the time, but at least you've had a go, and you might meet you might meet this network of people that would be able to help and support you, but also gives really just give you some sort of coping skills, I think, as well. Those sort of really practical things that we do on the course are really, really useful, because I think it's really hard sometimes when we if we're caring for others, sometimes we don't really look after ourselves. And I think one of the things that people realize when they come on the course, that you can't look after others if you aren't able to look after yourself. And I think the Wellbeing really does offer that opportunity to really reflect on how we look after ourselves.
Yeah, you can't pour from an empty cup, as they say, isn't it?
Oh no, it's so true.
Yeah. Okay, thanks so much, Sandra.
That's
so
okay, no problem.
it's really nice to hear from you. I'm going to pop over to Chris now. So Chris, do you mind maybe just introducing yourself, your kind of professional background and your work with us?
Yeah, definitely. My pleasure. Thanks, Owen, and thanks everyone who's joining us. Really, really excited to be here. So my professional background is psychology. So I started working clinically in the NHS, and my role in the team at the moment is head of research and development. My kind of specific work with return to work goes back kind of 3 or 4 years, when our team started working with Health Education England's supported return to training program, and we were one of the first providers to offer a training course, which Sandra has talked about, and which kind of grew into a much bigger program, which is great. And very importantly as well, for me, as well as this role, I am doing some doctoral work at Birkbeck University, focusing specifically on the needs of doctors returning to work, and how we can make the whole process better.
Okay, what piqued your interest in the first place to become involved with returners? How did it happen?
Yeah, good question. I think for me, having started clinically in the NHS and really enjoying working with people, but then moving into maybe a little bit more of a workforce development role, it kind of represented an opportunity to be back helping and working with people on a bit more of a personal level. I think you can't overlook the importance of some of the stuff we do around clinical skills, but this opportunity to work with people on things that really make a difference to their life, and work and health are such huge parts of our lives, was a really, really great opportunity for me.
Brilliant. And in terms of, I know we've mentioned the different return to work projects that we've delivered. What was your role specifically within them?
Yeah, so I guess being involved in the start, from kind of conception of the idea of our initial course was a boot camp simulation course, and alongside that we had a training course for supervisors. Really important for us not to just locate responsibility for improving return to work to be with returners. It's also supervisors and the system around them. And from that, kind of the rest of our courses that we've delivered, I've been involved in, but also working a bit more closely with Health Education England around their priorities, around how they're going to design and disseminate their support programs, being involved in events that they're running, and also, as I mentioned, the kind of growing research that we're trying to do in this area to try and make it a little bit more tangible and practical, the things we can do in this space.
Yeah, and I suppose I understand you've recently undertaken a systematic review on the needs of returners, and it's sort of born out of that need or the desire to put a structure and I suppose move towards an evidence-based offering. Can you tell us a bit about kind of how that came to pass?
Yeah, definitely. So we've just submitted a manuscript to the BMJ that looks at what the current literature says, so a systematic review on personal, social and organizational needs of doctors returning to work. So, we know that there are lots of barriers in terms of health, in terms of carer duties, and there's kind of support out there from the Academy of Royal Medical Colleges and HEE, but actually there's no evidence base to those things, that their majority, and to commend them, are developed from working with returners in more of a kind of lived experience sense. But as healthcare professionals, evidence-based practice is such a core thing of what we do. Why don't we do that for ourselves and for our colleagues? So that was the kind of motivation behind it, really. And then it will also follow from that we use this as a template to improve our courses, and also to do follow-up research that also focuses on interventions and pathways that we can improve for returners overall.
Yeah, so hopefully you've won over any of the skeptics among us. I think doctors, definitely we have that skeptic streak within us, so we always want to see the evidence. And of the work that you found, say the research that you found, who had undertaken most of it already?
Yeah, it's really interesting, actually. Very different to the other kind of systematic review work I've done, in that a lot of it was delivered by doctors, like you might expect. So not necessarily kind of autoethnography or about themselves, but you could see it was motivated by a doctor or a group of doctors with a personal experience. And as a result, there was a lot more qualitative work, more qualitative studies than there were quantitative studies, which also reflects the fact that we don't know exactly how to measure doctors' needs. We can do health measurements, but what about the more kind of pragmatic day-to-day real life things around our work and our lives? And there was also quite a lot of comments that didn't have a lot of commentaries and opinion papers that discussed the issue, but maybe weren't presenting any data. And there were also lots of kind of shorter reports where we've done a pragmatic project like surveying returners in our region, but we didn't really design it as a study. We're just kind of writing it up. So encouraging to see that there was stuff out there, and the qualitative work, some of it is really brilliant, but really nice to have a chance to pull it together as well.
Yeah, I wonder, does the body of qualitative work speak to the complexity and the variety of reasons why people, had to take a step out of clinical practice? And what sort of what themes did you find from the systematic review, Chris?
Yeah, so we managed to narrow it down to kind of 11 key themes that fit into those three categories of personal, social, organizational, that really represent the needs of doctors. And so, some of these are completely transferable across professions. Return to work is a really well-researched area in general, but not when it comes to healthcare professionals. And I think medicine in particular, there are some real idiosyncrasies to the profession that you don't see in other areas, whether it's the fact that if you're in training and you leave training, you're going back to a different place. You're contracted in certain areas for 4 to 6 months, but they're not really your employer, because they're not going to be able to give you consistent occupational health support. And so is that HEE's role, and you have your education supervisor, and there are professional bodies as well. It's incredibly complex. But so the kind of the 11 themes that came out, I kind of won't run through them all, but the most kind of important ones for me, I think work-life balance was really notable as a thing that came out for people. And you'd link that to the idea that you have had a change in life circumstance for lots of people who take a break. And linked to that is the ability to kind of regulate our emotions. Again, the nature of the reason why lots of people are out of training can be quite difficult. And even if, like hopefully your journey will be reasonably straightforward, there's still that challenge of going back into clinical practice and the kind of emotive needs of that. And then the personal level, the other thing we picked up that was touched on earlier is the idea of self-identity and self-perception. So the importance of self-efficacy and believing that we're able to do our duties in a high-stakes environment. It is incredibly important, more so than lots of other career opportunities. And identity comes into that very much as well. So, the idea is that as a healthcare professional and a medic as well, we have more of a kind of link between our personal identity and our professional identity than lots of other kind of professions do. Some of the social stuff I think is probably not a massive surprise around how important the relationships you have around you are, and that's professional and personal. So your family life, but also your friends and your colleagues. The most important thing that came out of that aspect of relationships and social is the role of a kind of senior mentor. Could be a line manager, could be an educational supervisor, could be a senior clinician, or it could be a mentor that you have beyond your training. But that there's kind of, I can't understate the importance of the relationship you have with senior people, in the sense that if it's negative, that's a real indicator of challenge and difficulties that people might face. And if it's positive, it's an amazing protective factor as well. And professional culture was the other kind of big thing in social as well, that the idea that actually it's a very strong, very historic, very meaningful profession, and that has some links to the way people might experience their breaks and their return. And there are also both kind of positive and negative aspects to that culture as well. And I'm sure everyone who's joining will have an association with positive cultures they've been in and maybe less positive cultures they've been in. And that was also linked to taking time out being sometimes a weakness, sometimes health related, that being a weakness as well, sometimes being kind of letting your colleagues down.
Perceptions, is it?
Yes, absolutely. Yeah, absolutely. Perceptions. So people feeling that I knew I was ill and I could have taken a little break and come back, but I let it get worse and worse and worse because I thought if I took time off, I'd feel like I'm letting my team down because of workforce pressures and other people having to cover for me, which we don't really want people to think.
No.
And then quickly on a more organizational level, we can't kind of underestimate the support that can be provided by an organization, whether it's a trust, an employer, the clinical area you're working in, HEE, or occupational health services, and there's also the actual nature of work itself. So how much do you feel in control of your workload and your job, your duties? How much flexibility is there in there? And so obviously that's reflected in some of the changes we've seen recently around full-time, part-time working as well.
Yeah.
So a run through.
So hopefully reassuring to doctors listening who have had very unique experiences to them. And I think that the fact that there are obvious common themes and common needs for returners is really reassuring. And the question is, I suppose, the $1 million question: how do you harness this to improve the experience for returners?
Yeah, definitely. I should say actually the other kind of findings that came out were related to resources. So that's the kind of flip side of needs, of actually what helps people, which we didn't intend to necessarily include, but having come across them in the literature, was really great. This again, linking across those and not going into too much detail, but as was mentioned earlier by Sandra, the idea of you're bringing something back to practice that you didn't have before, whether it's an empathy or an understanding of an experience or a self-awareness having been through something, that's a huge resource to bring back. And likewise, the idea of a positive mentor, positive social network, a peer support. So again, a link to what Sandra was saying around being able to connect with new people and other people to share your experience. And kind of on more of an organizational level, paid leave and supported return to training programs really do make a difference. There is kind of good evidence for them. But yeah, and so that's kind of important stuff for us to think about the question of, so what should we do and what can we do? I think the way that we've structured our recommendations and implications from it, and we'll take the work forward, is across those levels as well. So thinking about what can individuals do, what can your colleagues and family and supporters do, specifically within that, what can a leader or a mentor or a manager do? And then at an organizational level, thinking about your actual clinical area you're working in, but also the overarching stuff like your training program, Health Education England, your professional bodies, union, etc. I guess the few things that I kind of pick up are being able to have some time and some space to reflect on you and your journey. I think often these changes in life circumstances happen very quickly, and we don't have space to kind of think about them and what do I need and take that space. And that doesn't necessarily have to be in conversation with someone else or with a peer or family member. It can be personal time as well. I think I've already banged on about the importance of you know, a mentor or a senior colleague, which I really can't mention enough. I think that there's some points we made around the clarity of who does what. I think it varies everywhere, and you know, we can't standardize something across England, but the idea of what the responsibilities are that we expect of you know, a clinical area and a clinical manager, an educational supervisor, and the other key organizations, that clarity is absolutely critical, and something that's missing from current guidance, actually. And the other kind of big category that fits in of what we can do more is around workforce planning. So the idea of allowing people flexibility, whether it's phased return to work and supernumerary, whether it's keeping in touch days, people need that flexibility or to come back, you know, part-time, full-time. So that's a kind of super important area. And the way that, you know, rotas and shifts and roles are planned by the workforce planners in clinical settings is such a big factor for people, you know, things like nights as well. I think that the kind of the overall takeaway from me is that those are some specific areas we can do more in, but actually it needs to all be put together. And, you know, we need to be able to have guidance that links up, whether you're saying to an individual what they might want to try doing, or whether you're saying to, you know, the BMA and the kind of major professional bodies, this is the stuff you need to think about professional culture, you know, and stigma and support, and that all needs to be linked up.
Yeah, so there's a lot for them to chew on, definitely. So Chris, thanks so much for discussing kind of about your systematic review, and I think that was really interesting. From the sessions you've done with the returners, was there anything that surprised you?
Yes, loads. I honestly, I thought we were going to kind of give people some clinical skills and have some conversations about how they're feeling, and it would be better. But I was absolutely astounded by the diversity of experience and stories that, you know, you kind of come away from the course more in awe of the people that have attended than in what you've delivered. And,
Absolutely.
you know, I'd definitely say that peer support element we've mentioned of hearing returners sharing their stories between each other, supporting each other, you know, continuing to be in touch a year, 18 months later, was just like such an amazing group of people to work with, and such an amazing ability for peer support. You know, we're all in a caring profession for a reason, and being able to do that to each other was so nice. And I think, as Sandra said, just seeing the realization on people's faces when they realize they can do something. And, you know, there's lots of things you don't forget, and obviously some things that do change and some things that are difficult. But when you're able to see that sudden realization on someone's face of like, wow, actually, I can still do this even after a break, and reconnecting with their core values and something that is a big part of their identity was, I was shocked by how great it was to see. And I'm still shocked by the stories we get 2 years later of people explaining our journey.
I was going to ask, was that reflected in the feedback? Do you hear from returners later? Do they get in touch?
Yeah, I mean, kind of not in a research sense. We haven't managed to do much longitudinally and capture those kind of stories, but in an anecdotal sense, you know, the odd WhatsApp message or email, or I had a phone call early this week with a returner who came on our original course, and she's been really helpful in getting the message out there about what we do, and is still involved in social media groups and things like that where returners can be in touch. So kind of brings a smile to my face big time.
Any advice for any returners listening in, Chris?
Yeah, I guess it links to most of the stuff I've said, really. But I guess to kind of recap, taking time out to think and talk and reflect, whether that's with you, whether it's just yourself, whether it's with other people, whether it's journaling, whether it's talking to a peer colleague, someone that doesn't understand medicine at all, just that time and space to reflect is so important. And, you know, can't underestimate the value of peer support and speaking to people with a similar experience as well, less in the sense of processing and reflecting and more in the sense of connecting with other people. Don't be afraid to self-advocate, as hard as that may sound. You know, it's fine for us to be critical of the system we're working in and feel not supported, but at the same time, still be able to do that in a positive way where, you know, we're self-advocating because we want a positive outcome of returning to work. And, you know, again, kind of think about mentor and your senior relationships, because there's such clear evidence of that being a really supportive factor.
It's very empowering as well to know what your needs are going to be in the domain sense, you know, for returners, so that they can really plan that maybe with their supervisor when they get back in, and maybe identify, say, within a scheme or within a service, if there's maybe a deficit, they can mitigate it somehow. Thank you so much, Chris. That was really helpful. Do bear with us, guys. I'm going to... Oh, one more thing.
Oh, yeah, I was just saying one more thing, if I can, just to kind of close the loop of the research work we're doing, but the next stage of which is for us to develop a kind of structured tool that is a way for people to assess needs that, again, you can do individually, you can do with a colleague and a peer, or you could do with a manager or a supervisor, and then kind of test the acceptability and feasibility of that, having co-produced it with a load of returners, and then maybe even try and do an intervention study on it as well. So hopefully just to show that we are continuing work in this area.
Amazing.
Yeah, sorry, I'll stop, Owen. Thanks.
Perfect. So lots in the pipeline. So thank you so much, Chris. So on that note, I'm going to invite Sarah to join us by turning on her camera and mic. Great. Let's see. Hi, Sarah. So Sarah has very kindly joined us at the very last minute, I'll add, so really appreciative for her time. I know she's extremely busy today. So Sarah, you were a returner, and it would be really interesting to hear just a little bit about your professional background first.
Yes, so I am probably a little bit different to a lot of returners in that I've had a very long time out. So I was I had a very sort of normal route to start with. I did a medical SHO rotation, got my MRCP, was a medical registrar for a short time, and then switched and qualified as a GP, and then had my first child, and then stopped. And that was 13 years ago. I had 2 more children. I did lots of voluntary work and sort of had achievements outside of medicine, but did no medicine at all for 12 and a half years. And thought about coming back and didn't really know how to go about it. And sorry, it's building work. And then COVID came along, and I got a temporary license back, as did everybody who had time out. And sort of thought, gosh, now or never. And actually before that, I had been on your course. So I came on the 3-day return to work course. That was a huge turning point for me in sort of believing that it was possible. And it happened on our course. There were a lot of long career break returners as well. So a lot of people in the same situation. I then contacted, after procrastinating quite some time, contacted local consultants about coming back to hospital medicine. And they were delighted to hear from me. And I started back with a 3-month honorary post, so an unpaid post, because I'd been out for so long. And then applied and got an SHO post in geriatrics and some acute medicine. And I've been back for 6 months, 3 months paid in a proper role. And I'm getting more and more responsibility. I'm not quite back where I was, but I'm getting there.
That's great. So, and I think, you're thinking back on our poll there. I'm not sure if you're online for that, but it sounds like most people in the audience have been out for less time than you were. So hopefully that's some inspiration for them. And so thank you, Sarah. So I was just wondering what challenges you faced in starting the process of returning.
Many. So I think some of them were real and some of them were in my head. I think the real ones were IT based. Last time I worked in a hospital, it was all hospital handwritten notes, and now everything is on electronic record. And I'm not a very good typer. So I had to get up to speed with that. I think medicine had changed. There was a lot of new protocols and new medicines and new terms I hadn't heard of. And I'd been out for a while, so my clinical skills were rusty. But the gap between what I perceived and how far behind I was and what was true was probably shorter. So I think I definitely was inflating things in my head.
Okay.
I think the biggest challenge was probably confidence and belief that I could do it. And that took some getting over.
And you mentioned that you probably overestimated the gap in the knowledge and how quickly it would take you to adapt. And you're probably a bit hard on yourself, really, in doing that. It sounds like you did that very well. And then, so you said what surprised you was the confidence. And was there anything that, in terms of the return to work support and return to work program that made a difference with confidence?
So I didn't have a formal program because I had been out too long, and because I wasn't going back to a training number, I wasn't eligible for the support program, which looks fantastic. So I had to sort of make my own. And I think your course was fantastic. So I did some of the simulations you mentioned, and that's when I realised I can still do this. I can still run I had an anaphylactic scenario, and I can still remember it, 10 years. And so Health Education England. So I set up a couple of support groups on Facebook for people for doctors who've been out for quite a long time. And out of that, some of the support team did some HE did some webinars for updating. So they were really, really, really useful. And I think that having consultants the thing that really surprised me is actually how welcoming the consultants were, and how I thought maybe I'd be a burden, but actually they were delighted to have me. And having a supportive consultant and supportive registrars were really, really important.
Okay.
As well as the sort of peer support.
Yeah, I suppose despite the diversity of experiences, as Chris was highlighting, that there are a lot of common threads. And did you find connecting with others in the same boat sort of made the whole thing a bit less isolating, less daunting?
That's been an absolutely huge factor. I don't think I would have done it if there hadn't been other people who were doing a similar thing and been out for over 5 years. Okay. We do have a WhatsApp group, so from the course, the Maudsley course, but also from our Facebook group of people who've been out for a long time. And we're seeing more and more people go back, like after 8 years, after 7 years, and that just builds us all up. I think it has a sort of ripple effect to believe that it's possible.
That's great. And if you could go for a coffee with your past self, and this is a past self that's out of practice and wondering about returning, what advice would you give?
Stop procrastinating. I think that I was because I've been out for a while, I wanted to have this perfect job and perfect life and sort of work out what that, was it general practice, was it hospital medicine? And actually I just needed to take that first step. The first step was the hardest. And just to do it, it's much easier to make a decision about what's right for you when you're doing work rather than looking after 3 children. So stop procrastinating. I think also to have a belief that because I was good once, I am likely to be good again. My inner core of skills and personality hadn't changed, even though I believe it had, and I thought there's no way I could do it. Actually, now I'm sort of gathering evidence to think it is possible. I can still do it. So believe in yourself, because if you did it once, you'll be able to do it again.
Absolutely. So take those first steps, don't be afraid, and to back yourself as well, to believe in yourself.
And I think that really to have a support group. So to find people who have been in a similar position.
Great. And any advice there for the returners or potential returners that are listening in today? Any final words?
I think talk to each other. Take small steps. Know that there will be difficult times. You're going to have really good days and bad days. And that's okay. Try and find some friends within the hospital, whether it be a registrar maybe who's involved. There's quite a lot in each hospital. There tends to be a registrar who's involved in support or development. Try and link up with them, and have a look at the Health Education England webinars, the update webinars on the COVID returning. They're very, very useful.
Brilliant. Thanks so much, Sarah, and thanks again for joining us and sharing your experiences and doing so with such aplomb at last minute. So thank you, Sarah. So Hannah, I'm going to invite you in. So Hannah, do you mind introducing yourself and just maybe talking a little bit about your experience with Maudsley Learning?
So I'm Hannah. I am the Research Assistant and Training Coordinator at Maudsley Learning. A bit about my experience. I've worked in many different industries in different capacities that include both public and private sectors. And when I was younger and working in these different industries, I started to become interested in people's behaviour in the workplace. And that was really a driver for me to go and do a degree in psychology, and that was my BSc, and I did that at Luton. And throughout that, obviously, you learn about different topics, and one of them was organizational psychology, which really piqued my interest, and got to learn about all these different aspects of psychology in the workplace. And one key kind of topic was well-being, which I just absolutely loved, and so decided to do a master's at IOPPN in organizational psychology and psychiatry, and the main focus of that was all about well-being in the workplace and all the different antecedents that impact it. We learned about different strategies on how to manage it. So yeah, and from then I started a position at Maudsley Learning, and I'm doing lots of different work around workforce development. I'm involved in various different research projects. We do evaluation of all of our courses, and have been involved in bid writing. So yeah, it's a little bit about me.
Great, thanks, Hannah. And you mentioned that you became really interested in well-being at work. Why is well-being at work so important, do you think?
I think because we spend so much amount of time of our lives kind of in the workplace. I think it's almost a third. So that's a big chunk of our life. And for me, I think that should be an enjoyable experience. I think gone are the days where we go to work and earn money. Like, you know, a lot of people want more out of their work nowadays. So that's why it's quite important to me. And there's so many different ways that work can impact us, down from the relationships that we have with people, the nature of the work. And it's not just about kind of the individual as well. Like there's responsibilities from the organization's perspective and also a team. So it's bringing that all together and teaching people kind of about that is a real driver. And I think it's really important. Definitely.
And I think it's probably something that really was overlooked for so long. I certainly didn't hear about much of this when I was studying undergrad, and it's really so important. I mean, ultimately, when you talk to any of your friends in different posts, that's what they end up talking about, is how they feel and how they're coping with it. And, you know, it's a major factor in people's career choices, I think, how they feel in their post and how they're able to cope with the challenges that it brings. And what interested you to becoming involved in the return to work that we do?
Well, as part of my master's, we did like a unit about occupational psychology, and we had quite a few lectures about returning to work and that process. And I found it really fascinating because it varies from industry to industry. And I think that process is really important when people come back to work. You know, people take time out of work for various different reasons. And those reasons can have an impact on when they return. And I think it's important that we support people to have a positive experience when they're coming back to work, because if it's a positive experience, they're more likely to stay in work, they're more likely to enjoy it, it improves their well-being. And there's lots of other ways it can impact a person and also the organization. And there's quite a bit of research as well that says that if people have like a negative experience when they return, then they're more likely to go off sick quite quickly as well. It can impact their productivity, how they conduct their work, their relationships. And realistically, nobody kind of wants that, because they're not going to enjoy being at work. So yeah, great. That's why I was interested in it.
Brilliant. Thanks, Hannah. So thank you very much, Hannah. And thanks to our speakers. I'm just going to pop my slides back up before we move towards the Q&A. So we plan in the new year to run an interactive workshop, informed largely by Chris's research into these recurring themes that returners have. And there'd be 3 parts to the workshop over one day. First session on self-care, looking at psychoeducation, well-being, work-life balance, resilience. The second session focusing more on identity and personal reflection around self-perception, values, priorities, goals. And finally, this last session looking at group care and relationships, examining connection, culture, stigma, and some of the challenging conversations we have to have. So we will probably have, if we have your email address, we'll notify you about this, and otherwise it'll pop up on our email. And also, if you're linked in with any of the Health Education England mailing lists, you'll hear about the session as soon as we have it advertised. In summary, I think returning to work can be daunting, and for some it can prove especially stressful and isolating, and not all paths are the same, but many returners share the same concerns and needs. And although improving confidence is a key priority, looking after yourself, managing personal skills is an important need also. This is a very helpful website to start looking at some resources and supports from Health Education England, and I encourage you to take a look. You can also keep an eye on our website and email us if you have any queries about the upcoming workshop in the new year. And for now, I'm going to open up to see if we have any questions.
Sure, thanks, Owen. I can dive in with a few responses, and,
thanks, Chris.
If people want to continue posting, that would be great. So thanks, Dr. Pope, for passing on. Thanks to Sarah for sharing her story, which is truly inspiring. A few questions about people returning at different stages. So consultants. We have had consultants, GPs, lots of different specialties attend our courses. And although HE support program technically isn't for people out of training, I think ourselves and lots of other providers who are funded by it certainly aren't going to discriminate on that basis. Likewise, if you want to get in touch with me, I'm happy to kind of go back through HE channels, because I know they are trying to improve their support for people who aren't currently on a training program. And yeah, certainly all of the kind of resources and courses we run would be open to them. In terms of stories, none off the top of my head, but definitely we have had people come on our courses and go back to work. Sarah and her social media groups may be better placed to pick out some of those stories. And in terms of courses in future, we don't necessarily have a boot camp coming up because HE couldn't sustainably fund such great multi-day training. But the kind of workshop series that Owen mentions next year is taking a bit less of the clinical focus, which exists in other parts of the country around sim courses, and a bit more of the personal focus that picks up on a lot of the themes that we touched on today. So yeah, we'll certainly keep you guys up to date with those.
Great. So was that everything for the Q&A, Chris?
Yes. So I think that the main kind of questions are around HE support for training returners. I think that my understanding of the reason for that is that the funding originates for the support program from the negotiations around junior doctors' contracts a few years ago, and there being a focus on trying to reduce inequalities in career development. So particularly thinking about mothers taking parental leave and not being disadvantaged from having time out of training. So that is the not necessarily a hugely helpful or satisfactory reason why it's focusing on trainee places. But from that, we've been able to try and broaden it out more and push HE to provide more support as well. So hopefully we're getting there.
Okay. Do we have any final question that's just come in or anything?
I think those are the ones that I can see on there. But yeah, definitely. And Sarah's very kindly put her email address in response to one of the questions if people want to get in touch, and likewise to me. Yeah. So I think
great.
Yeah, so I definitely do know of a couple of consultant returners. So one who is a consultant psychiatrist who was out for 7 years and has gone back to a consultant job and is doing well. And then other specialty doctors, a paediatric specialty doctor who has gone back to a specialty doctor role, but a paediatrician who is out for 7 years and again is doing brilliantly well. So yeah, I'm very happy to be contacted and link people up. And as I say, we have got those 2 Facebook groups for returners as well if people want some support.
Great. Okay. Thanks so much, Sarah. And thanks to everyone. Thanks to the panel and thanks to everyone that's joined in online with us today for this Maudsley Learning webinar on return to work, personal skills and wellbeing. With that, I will bring the session to a close and wish you the best of luck.